So for me to see that 300 plus people are dying every day and we do not want to do anything about it is not acceptable. So I'm trying to provide advocacy at a national level so that we have better ways of taking care of these patients. Patients have better access to us, and the physicians are not intimidated by the regulations and the insurance companies trying to help these difficult patients.
Thank you for this choice because I work with many doctors and most of them actually just avoid this specialty.
That MATE Act, Medication Assisted Treatment Expansion Act, was passed in December of 2022, went into effect June of 2023, and they were hoping a lot of doctors will get into the program. The problem is all the state and federal regulations that have been put in place in the last 20 years are still in place. So until unless those regulations are reversed, more doctors are not going to risk their license and go to jail and become homeless taking care of this difficult situation. So the government has to be mindful that doctors should be allowed to treat patients without the intimidation, and there has to be some education and incentives to do. The second problem that occurred in 2005, the federal government reviewed the data 2000 and said there is a little bit of diversion of Suboxone, buprenorphine on the street. Means people were like they were trading OxyContin and other pain pills, Vicodins and Norcos. They were trading Suboxone. So think of this from 1995, OxyContin abuse and overdose deaths is going up. We have a treatment arm in 2000, and then they put a dagger in it saying we're going to monitor the diversion of Suboxone as it impacts the communities. So the treatment arm didn't go up. If that would have gone up without restrictions, we would have had less number of deaths. But they slowed down the treatment arm like this, and that created this problem, which I call criminalization of the treatment arm. The third problem that occurred is the federal government sued the company that makes Suboxone for $2 billion. So these are the kind of regulations that has created a problem. The buprenorphine, the treatment medication, got criminalized. Um, and so we need to decriminalize that and so that doctors can write buprenorphine.